Hey guys, so we made it through the systematic method, but now let's bring it all together and try to see if we can answer it all about one rhythm. So let's say that and like actually figure out what the rhythm is, because before we were kind of just breaking down the pieces. So let's, if I can find this mouse, this damn mouse thing. Okay, there it is. If I can find this. All right, so first things, we want to figure out the rate. So I've got let's count the rate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 11, 12, 13, 14, 15, 16, 17. So I got a rate of 170. Is it regular? I mean, I can just tell by looking at this that there's some that are shorter, some that are longer. So I'm going to say that this is irregular. So I'm going to say irregular. Is my QRS skinny or fat? It looks like I've got a skinny QRS. And are there normal P waves? I forgot about that. I do not see normal P waves. I see kind of squiggly P waves. The answer is no to that. So I have all my information now. I have a fast rhythm. That's a fast irregular rhythm that's skinny. So I'm talking about a top of the heart problem. So I have to be atrial fibrillation, atrial flutter, or SVT. And I have irregular P waves. So when it comes to atrial rhythms, if I have any irregular top of the heart problem, the only rhythm that it can be is AFib or A-flutter. And then I look at it and it's got irregularity. There's no pretty sawtooth, beautiful organized waves. So this is going to be atrial fibrillation. So you can see the reason that we're collecting all this information isn't because one part of this information is going to tell me everything. But if I look at it as a whole, I can kind of start breaking down and like narrowing down what it is. I think we have 4 of these. Let's do these together. All right, so now let's look at this one. Let's see if I can find my mouse. Oh, all right, so let's count. We got 1, 2, 3, 4, 5, 6, 7. So we've got a rate of 70. And it looks pretty regular. It looks like there's the same space between everything. So I've got a regularity. There is a P wave before every QRS. So you can see P wave QRS, P wave QRS, P wave QRS, so on and so forth. So that's going to be a yes. Is my QRS skinny or fat? And so you might sit there and be like, oh, it looks kind of fat. No, this is a skinny QRS. It's not very wide. It's only like 2 boxes wide. So we are looking at a skinny rhythm. So what am I? So I have a skinny QRS. I have all my parts, P wave, QRS, T wave. I have a normal rate, normal rhythm. So if everything is normal, then what do I have? I have, if I can write it, dramatic pause, normal sinus rhythm. You wouldn't think I would throw a normal one in there, would you? I sure did. All right, let's do another one. So for this one, let's see if I can find it. There's a lot of red here. So I have a rate of 1, 2, and 3. It's a rate of 30. Is the rhythm regular? Well, there's only a couple beats here. I know that this is red on red, so maybe I should change my color. So let's see, ink color, let's do black. So let's see, let me go back over here. So I've got a, looks pretty regular in between here. So I'm gonna say, yes, it's regular. There's a P wave for every QRS and it looks regular. So I'm gonna say regular, so yes. Regular and yes. And is it skinny or fat? Again, this is only 1 box, so it's skinny. So I have a skinny regular rhythm. I have P wave is normal, so it doesn't look like I have a top of the heart or a bottom of the heart problem. So if you have normal P waves and a skinny QRS, you have some sort of normal rhythm. So if I have some sort of normal rhythm, but hey, wait, what's my rate? My rate's 30. So everything is normal, but it's a little slow. What do I have? I have we caught sinus bradycardia. Woohoo! I just realized I have all these and I don't have I probably should add one more. So if you're in my class, you might see one more added. And I apologize. Sometimes like I think of things as I'm doing this, but yes, I would want one more example in here just to have some variety, but let's do this last one. Let's see. So what's my rate? I've got a rate. Let's see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So I've got a rate of 200. Rate of 200, it looks pretty normal. There's the same distance in between both. So I'm going to say it's regular. Is there a P wave I can see? Now, it almost looks like there's a P wave here in this little notch, but I can't discernibly say that there's a P wave for every QRS. So there's something weird about the P waves, but I have a skinny QRS. So I'm going to put question mark for the P waves. So I have a rhythm that is fast, skinny, and regular with maybe some P waves, but I can't quite tell. So if I have a skinny rhythm, remember, I can narrow it down and say, okay, it's either AFib, A-flutter, or SVT. So I don't think it could be AFib because it's regular. And then the flutter, usually they have those beautiful sawtooth waves, and I really don't see any sort of P waves for this rhythm. So if I have something fast and skinny and regular, I'm thinking about SVT. So what I realize is I don't have a ventricular rhythm here, which would be helpful to do, but I do have other videos where I go through rhythms. So it's not that if you're not in my class, it's not that you're without hope. I have tons of other videos. Just go check one of those out where I take you step by step in the rhythms. Anyway, we made it through this practice. The next step is going to be, or the final step of this PowerPoint is just going to be looking at what can I do as the nurse to help a patient who is going through a dysrhythmia. So that will be the next, and I believe the last PowerPoints or last slides. See you for that one.